Good afternoon and welcome to Saturday Sesh. My name is Trey Reckling. I'm the founder and director of the Academy of Cannabis Science, and so glad to have you here today. Saturday Sesh is our opportunity to welcome professionals from the cannabis industry of all types to come in and talk to us about cannabis, to talk to us about what they're passionate about and why we likewise should share that passion or should consider it. And today we're very glad to have Dr. Abraham Benavides back to SESH for his second time. Dr. Abe is a doctor in Costa Rica and a highly touted one or highly recognized one. He earned his MD from George Washington University School of Medicine and Health. He also studied biology and business management at Boston University. He founded Cannabis as Medicine Interest Group as a student, and it was the first of its kind at a US medical school. And he did that because he's like, hey, doctors, well, I don't want to paraphrase him, but I think he was recognizing that doctors don't have the baseline knowledge in cannabis. And that it was a really shame that a patient could go to their doctor and ask questions and the doctor not be prepared. So he started the group. He said, hey, well, let's create that bridge. He also is a strong advocate for medical cannabis education, for public health, for law reform, and he's authored several educational resources, including and ebooks, the continuing medical education courses on cannabis. He works as a cannabis consultant for GWU Center for Integrative Medicine, and he also is involved with Veriheal, Cannakeys 360, Cannabis Science and Industry Center of the Americas, and has been recognized throughout South America or South and Central America for his work and his dedication to the cause. And it's my pleasure to welcome back Dr. Abe. How you doing, Dr. Abe?
Hi, Trey. Thanks so much for having me here. I'm so excited to talk to you and your learners again. I really appreciate the invitation as well as the very warm and generous introduction. Thank you. It's
Hey,
an
well, all
honor.
all deserved, all deserved. And we caught your passion last time and really appreciate what you're doing there. And this bridge, actually, let's start with the bridge. Could you talk to us a little bit? Because I told my version of the story, but why did you found the group? Why did you found that student group at the medical school, and how was that?
Yeah, I think it's also a right place, right time kind of situation because it would not have existed if not standing on the shoulders of giants, so to speak. So DC had just legalized cannabis the year before, and that was through the efforts of Dr. Malik Burnett and as co-chair of that initiative. And so he was actually speaking at the first Cannabis Congress on Capitol Hill during my first year of medical school. And so I went to attend the talk and try to, learn more a little bit about cannabis policy or what does it look like in DC now. And so he was talking about how that there's a big gap in this education. And I was like, oh, that's right. I've been in med school 2 months and, we haven't, yeah, I've already heard negative things about it. And it's like, I was like, I don't think that's really fair. I think that there's more to the story that's not being told because when you actually look at the research, having no direct fatalities and having an immense therapeutic potential, I believe that as doctors, it's our responsibility to learn about these things, whether you're going to be recommending it or not. It does affect everybody's health because the endocannabinoid system is in all of us, also many animals, vertebrates, and even some invertebrates. And so it's just another organ system that we should be learning about. And so when I was at his talk, I asked him, what can we be doing at the medical school level to, push for more education? And he actually came up with the idea for me, which is to say you could start an interest club or an educational group. And I was like, oh, that's it. So I went straight to my dean's office. And so I talked to one of the deans of public health, Dean Bopper, Lawrence Deaton, who used to head the FDA's anti-tobacco division. And he was like a psychiatrist from California. And he was very much about this idea. He was very much pro cannabis and was kind of my green light or my shield from the dean's office to go ahead and do this. And so I networked with local professionals. So I found Dr. Mikhail Kogan, who is my longtime mentor at the GW Center for Integrative Medicine. He's now my colleague since he's the CMO there, and I'm a cannabis coach there. So I worked very closely with him. I take on all of our most advanced or difficult to treat cases. But I also see, mild, moderate, severe, or, and people will get better after just a few treatments. And then it's really about seeing them next year for their renewal and touching base and making adjustments as needed. But when as a cannabis coach, I have much more time to learn about the patient, what's important to them in their lives, what their goals are for functionality with, their life, their work, their family. And then I try to match their preferences for their lifestyle with the right selection of cannabis-based medicines and what schedule is going to work best for them and fit, their needs. Do they work night shift? Are they older? Do they caretake for older parents or younger children? All these things need to be taken into account, and there's not enough time in the 15 minutes to learn all of that thing as a PCP or another kind of specialist. So gearing cannabis education is important to know about who your audience is, to know how much detail they need to know. And so I guess here we're talking about medical education, but also education at all levels, right? From your level to also the average consumer to high level researchers. So my goal with CanMig was to educate next generation of doctors. And then I did a research study with them that basically just proved very simple things, which is that most of the students had met a patient who had a question about medical cannabis, like 60%, but then that same proportion felt completely, or greater than that, felt completely unprepared to counsel the patient on cannabis. And so my study was very simple, and it was based off the very first study, which was in 2017 by Evanoff. And so we modeled it after that, but we made it about our school, and we made very simple points about that, but also indicated that they wanted to learn more. So it wasn't just that the new generation of doctors is like totally closed off to this idea, which maybe is sometimes the sentiment that people think, but honestly, it's just I would say like half my class was probably against it and thought it was crazy, and the other half of my class thought that there was something to it. They just didn't know enough about it. And so that's often what I most encounter with today's doctors, is that most of them they want to recommend it because they want to help their patients, but they really have no clue where to get started. And so that's kind of where I come in.
Excellent. Yeah, and thank you, because we adjusted our schedule. I had some personal stuff going, some health stuff going last week. We pushed this meeting out a week, and when I was talking to you about it, you're like, well, it's a good thing in this capacity because there's this research study coming out, and I would really like to talk about it. And I hope your students will be interested because it's really relevant and it's important. And so that's where I would like to turn now, if you don't mind. And we can, or I can put the link in the chat in a little bit. I just don't have it in front of me right now, but we'll make sure you all get that link. But the study, and I will pair. I'm gonna
I'm putting it in the
I'll set it up, and then I'll let you build on it a little bit if you don't mind. So it was a study. Oh, thank you. It's in the chat now. And so it was a study about the medical competencies and understanding of medical professionals of cannabis. And this study, after they completed it, the study proposed 6 competencies for medical students that they needed to engage in. And so, like, right along the lines of what Dr. Abe was doing, it said they first need to understand the endocannabinoid system. And we know some of you are new students, so endocannabinoid system, and Dr. Abe can do a better job of this in just a minute, I'm sure. But endocannabinoid system is a body system, just like our respiratory system, our circulatory system, our pulmonary system. It's a body system, but unfortunately, it's one that even a lot of physicians don't know about it, and because they didn't get in medical school, and that's why we're talking about it. But it's a system that's built to receive cannabinoids, whether they're plant-based cannabinoids, or, and those are phytocannabinoids, or endocannabinoids, the ones that our body actually makes. Our body's built to receive this, and in part why it's such a safe medicine profile. So that was the first. Number 2 was being able to describe cannabis constituents and the pharmacology, to be able to recognize the legal and regulatory context of cannabis as a medicine, to evaluate evidence for therapeutic use, to identify the risk and safety concerns, and then finally to be able to apply clinical skills for patient care. So all that kind of stuff you would hope your doctor would know, right? I think if you went to your doctor and the doctor said, I would love to treat you and talked about your blood pressure, but I didn't get anything about the circulatory system when I went to med school. So you'll have to pick that up with somebody else. Like that would be unacceptable. Like we wouldn't think twice about looking for another doctor. But that's kind of where we are. And it's really um, not casting shame on the doctors because if it's not presented, if it's not teed up, it's not required education. It's on them to find it on their own, and that's not fair either. So, Dr. Abe, I started with the end. I started the story with the end in mind, but what was it this about the study that like really got your attention? You're like, oh, like really jazzed you up.
Well, it just so happened that at the same time I was already planning to launch Medic CR, which is basically my kind of like a new CanMig here in Costa Rica, but aimed for medical professionals. And so my mentor, Dr. Kogan, is actually one of the co-authors of this study. And he had let me know, because this study is actually many, many years in the making before I even joined CIM. And so he let me know about it. And so now it's finally out, but I am excited about it because it gives me the exact framework that we need at Medic CR, and that I think obviously American medical bodies need to adapt this framework for trying to get at least a core competency for cannabis recommendations, and that's essentially what I'm going to call our basic certificate program, which is I'm going to call it a core competency for cannabis recommendations, which is basically what in that of itself, you need to understand all of these things basically. And then, we will also have an advanced training course for people who want to do more, have like I'm going to call it a certificate of advanced cannabis practice, where we will have more like specialty specific modules, handouts, and all these other kinds of things. And so depending on how, deep the provider wants to know, but at its core, these are the main points that people should be learning about. And then also the other thing that's not very obvious from the study at a glance is that when you look at it deeper, they have supplemental information in there that dives deeper into these 6 points and creates, sub bullets for what is important in each of these. And so if you want a more detailed, because this is a very high level summary, there's actually supplemental info hidden in there. And I didn't actually know that until I went to EB Russo's talk on Thursday morning. So Dr. Russo, also another one of the co-authors, he gave us a good breakdown of the study and analysis and let us know that inside information that if you wanted to know more about each of the points, look in the supplemental info. And so we're using that essentially to create the framework for our course. And I'm going to be filling in with, the work that I've already done, but I also need to change it, update it, and make it, also suitable for Costa Rican doctors' audience.
Excellent. And if you all missed it, I don't know if anybody noticed that gold star name that Dr. Abe dropped there. Dr. Ethan Russo worked for GW Pharma, and he was instrumental in his team in bringing to the country, our country, and to the FDA, one of the first FDA approved cannabis medicines. And now it's CBD basically, but it is approved by the FDA, which is very unusual, and was one of the they were just one of the leaders in this research. Now, if you go and you take that medicine pharmaceutically, it's very, very expensive, but it does open a door. It lends credibility to the use of cannabis as a medicine. It does a lot of great stuff, and Dr. Russo from this area, from the Seattle area, is out there, is continues to talk, continues to preach on this subject as well. So glad that y'all have connected for sure. Could you talk to us a little bit, Dr. Abe, when you see these things, or actually when you speak to another physician, because I know there's the whole scholastic um, angle to this, and then there's just the personal relationship thing. When you encounter a doctor that says, "Hey, I don't know anything about the endocannabinoid system. What are you talking about?"
Oh,
What's
yeah.
your elevator speech? Like, where do you go from there?
It depends on how much time I think I have because you can go
Right.
very deep into it. But I think an elevator pitch is to say, I'm sure that you've heard about it or been asked about it by your patients. And it's just the endocannabinoid system is actually something that is present in all humans, and as well as many vertebrates and invertebrates. And it's something that you're, even if you don't necessarily plan to recommend yourself, is something that you will be asked about. And just like the main points of my study was, yeah. And so going into also debunking myths also is very common, because often I'll hear from them that, oh, there's not enough research, right? And so that's a big myth that needs to be busted, because the reality is you can tell that there are thousands of studies on THC, CBD, even separately and together. And there is a lot of information that you can use to start working with these things. And so that is just a big myth that needs to be debunked too. And another thing that I hear about is stigma. So a lot of doctors or providers will be like, I even had a patient who's a provider also, and was like, I've been a nurse for 20 years, and now I'm, finally coming around to the CBD thing, but I just can't get over the fact that it's federally, or, it was federally legal, or it's cannabis, or whatever it is. The best way to address that is to help them to understand where that stigma comes from, is to take a step back and say, I see where you're coming from, and I hear you. It's important to understand that that's the reason that cannabis has been criminalized for so long, is part of a marginalization effort in, very old school politics and public health that was weaponized against people and communities of color, people like, and have been used directly against people like myself. And I myself have been, adversely affected by the ripple effects of the war on drugs. And so this is something that basically you need to inform them that that's where all of this comes from. And so are these really ideas that you want to be wedded to and supporting today in 2025? Because once you know that, and know that basically cannabis stigma is essentially racist, and that is, once you let them know that, it's much easier for them to let that go, or if they acknowledge that. And so that's really educating the doctors is on how you change their minds, really.
And I imagine our students in the room know this, unless you're just starting your course material. But yeah, the history of the demonization of this plant is inextricably tied to racism, to bias, to political agendas. And so once we get past that, you realize, hey, this is plant medicine. There are many, many other plants that are medicinal that have never been demonized in the same way. And boy, billions and billions of dollars were spent to demonize this plant and to subjugate folks. And sometimes people, part of those systems, didn't even realize what was at the core, because the propaganda was great. The propaganda was well funded. The propaganda was very believable. And most of us grew up hearing it. And so it's an opportunity for us to reset and say, hey, what's the truth behind those messages we heard? And that's where I'd like to go next, Dr. Abe. If you all aren't familiar, I'd encourage you to look up Dr. Abe. Now that you have met him, those of you in session right now, when you look him up, you'll realize this man is right. You must write all the time, first of all, because he's written hundreds of articles reviewing cannabis research. So how do you help clinicians or patients separate those anecdotal benefits, the, hey, my friend benefited, or I benefited, or people in my family did this, which are all important information, from things that are evidence-based, statistically significant? Because we know both of those things matter, but how do you help people sort that out? Because the individual one-off stories can be very passion-laden and very convincing, but we
Mhm.
also need data. So how do you help folks navigate that?
Yeah, I think it depends on the level that they're at. If it is a medical and healthcare professional, then the best way to close that gap is like a subscription thing like CanaKeys, using having a solid evidence research base that is always being up to date. I work at CanaKeys also, and so what it is it gives you can search anything by condition, organ system, terpene, cannabinoid, and then I have updated all 300 plus medical conditions, and have started again from the top. I'm back at the B's now, but that's how much research there is. And so what it is it'll give you an overview, a synopsis of a breakdown of the studies, how many preclinical trials, how many clinical trials, how many meta-analyses, et cetera. And then it also gives you what percent of them were type 1 cannabis, type 2, type 3, gives you a more detailed background, were there any dosages, milligrams mentioned. And so it gives you a very helpful overview of the data, synopsized. And then Dr. Uwe and I will write a synopsis of the research to date. And then every year I go by and I update it. So for high level, if you're really serious about doing research and practicing with it, gotta go with a subscription like CanKeys, and or would recommend Journal of Cannabis Research. JCCR, Journal of Cannabis and Cannabinoid Research, by Marianne Liebert, is probably at least the one subscription that I would recommend if you like want to get at least one journal. That's the one that I recommend to Veriheal, so they get that subscription for me. And so, but they understand that it's what you need to stay up to date because it's such a rapidly evolving science. If you are on, for college, doctoral students, it's important to really fundamentally know how to read a research study so that when new ones come out, you can evaluate whether that study is reliable. This is just generally like an important interdisciplinary skill. And for average consumer, if you're talking to your average consumer, your average patient at the dispensary, letting them know that when you look to see in articles, know that the information, whether it's being medically or scientifically reviewed at all. So for example, on Veriheal, you'll see the work that I do with our authors. You'll see the author's name, and you'll see a time and date stamp, and then you'll see my name also as being medically reviewed by me. And so reputable websites will have a medical or scientific reviewer, someone like me, to help ensure that what the author is saying is, up to date, factually accurate, ideally. And so my best practice for this is when I'm reading and working with a writer, is that the evidence that they're citing, is it primary research? Ideally, if it's available, most of the time it is. If it's a third party research, is it at least something like NPR or something reputable, or a CDC? And then also, ideally, it should be up to date. So ideally updated within the last 5 years. So in medical research, what defines recent medical research is within 5 years. So if an article or something blog you're reading is like 2018 or something, you should find a different source, something that's more updated. So general rule of thumb is look for 5 years, because in medicine, beyond that is considered old, is no longer recent, or at least no longer recent.
Right.
And so that's where, so when I'm working with the authors or with the writers, if they cite a paper from 18, I'm like, we'll find it. We can definitely find a better meta-analysis or something that came out, something that's stronger research, and always choose things like meta-analyses. Being familiar with those terms, meta-analysis is a study of studies. Understanding how to judge and grade research over others is an important skill. But for the average consumer, at least knowing that it's within 5 years, peer reviewed by somebody, and it's got citations on it, that's that's a pretty good start.
Great. And we're all about, at the Academy, all about deeper dives, right? So we provide a level of understanding, and then often in your coursework, you'll see, hey, for a deeper dive, here's some articles you might want to read, or here's some research. I understand that the research often is not written from, it's not written to be read and understood by people who are not academics, right? And it's frustrating to me. And I will tell you, one of the best, I think, of real good use of AI these days is to allow the AI to interpret that study. So if you're one of those people who are like, oh, the curtain comes down when I start reading something that's just academically wonky and written for other researchers, my eyes shut. That's okay. I would encourage you to take a link, just like what Dr. Abe has put in the chat here, drop it into an AI tool. And I know AI has its detractors, and sometimes for very good reasons. But if you're a fan and you're willing to use it, drop that link into AI and says, hey, will you summarize this for me in plain language and give me in bullets the main points of the research? Even if you just do that as a preliminary step to reading the real research, or if you don't have time to read the real research and you want to tear through a bunch of stuff, it really will make you more efficient. Now, like everything AI, you gotta fact check it and not rely on the interpretation being right the first time. But anytime we can lower a barrier to entry for folks, that's the intention of that advice. So thanks,
Yeah.
Dr. Abe, for talking about the time frame though, because things do collect dust, right? And research is rarely evergreen. And to your point too, that some people just kind of cop out of this, and they're or however you say, they're like they kick the can down the road. They're like, well, there's not enough research. This is probably the most researched plant in the history of man. Maybe garlic may have more studies about it. I don't know, but um, cannabis has a tremendous amount, hundreds, thousands, actually tens of thousands. So if you go on PubMed and type in cannabis as medicine, you'll get an idea. Tremendous amount. And then as you wade through it, follow Dr. Abe's advice. Look for the 5-year mark, and then you can kind of start to parse some of that out.
And in
The
terms of, oh, sorry, and the last thing,
please,
just to go off what you said, is to make the research more accessible. It's I take it upon myself as a responsibility as a medical reviewer to make sure that when we write about the research, that we're writing in plain language. That's something that I
thank you.
emphasize to our writers, because I'll have to often rewrite or paraphrase something, or I take out they'll write the scientific word first and then parentheses what that means. It's the opposite. You have to put what people understand first, and then you can put the scientific term in parentheses, like apoptosis or whatever. And then if people who want to know that now, but that's not really the main point. The point is have things in plain language. And more studies are doing this these days, where they have a plain language summary at the very top. I mean, well, the best ones will have an abstract and then like a plain language abstract, which describes things. And for people who want to learn more about how to use plain language in their writing, if you're a cannabis blogger or something like that, there's a really good there are really good guides online. I think CDC has one on plain language writing for healthcare professionals. Just in general, it's not about cannabis specific, but I'll recommend that to the Veriheal writers as well, to be like, look at this for tips on how to write in plain language, because making the research accessible to people is like, you got to make the rubber meet the road.
Absolutely. And boy, thank you so much for that. Because it's not a focus of a lot of people who are academic writers, because they're like, hey, my crowd will get it. But we want people beyond that crowd to get it. We want
Mhm.
as much as possible for research to be accessible, because the interesting thing when you start reading research, you'll realize it in some cases can be 20 years ahead of what's practiced in your local doctor's office or local hospital even, because it takes
Mhm.
a while for that research then has to be verified and verified again and challenged, and then for the education to spread and for people to start implementing. But when you start reading research, you're going to be several steps ahead. um, Once again, I say that with the caveat that one research study does not make truth. You know, science is about proving and disproving, and so don't lean on any one research study as the be all end all. But sometimes some people in this room might have conditions you're like, hey, my doctor doesn't know how to have a conversation with me about this, but I found this research. And so some people go into their doctor's office armed with a stack of information and say, hey, look, I've read this. If you
Right.
haven't, this is your copy. I would love for you to take some time and read up on this so we can be partners in this. Because it's frustrating for me to come in and you just say you don't know. And so it's not our responsibility to teach our doctors, but if our doctors haven't gotten in at other places, we have a couple choices, right? We can find another provider, or we can work to try to educate the folks that we still want to engage with. So, what when it comes to being a practicing physician, it's also essential to protect my license and my reputation, to keep it in the lines, right? To understand state and federal law. Do you have any advice for folks, for other providers, Dr. Abe, as you talk to them and they're like, look, it's just easier for me to not, because I don't want to say something and somebody get in trouble, and things are still, laws are still being developed, and it's just a minefield. It's easier to not. Do you have that conversation with folks?
The best advice I would give is that this stuff is usually very state specific. And so if you're in a doctor in a specific state, you got to be familiar with there's probably a cannabis medical board or some kind of other cannabis regulating entity. No, the interesting thing, the part about being a doctor is not necessarily just knowing everything, it's knowing about where to look for things and how to look for things, because these things change all the time. Cannabis regulations do update and change all the time. Like in the time that I joined CIM, and we served DC, Maryland, Virginia. all of them have had constantly updating and changing cannabis policies that even I have had a hard time keeping up with because they're very inconsistent. And so anyway, knowing where to look for the information, knowing who the Department of Health has assigned to manage their cannabis board, and then you'll probably, in most states, you'll have to be registered with that board if you want to be recommending this stuff. But basically knowing where that resource is to stay up to date on the laws is probably the best if you are like just working in one area. I am in like all 50 states and Costa Rica, and so I have to constantly be knowing where to look it up, how many states now have medical programs. Now we're up to 40 as of September, when Texas just became the 40th one. And so like, and that was just like last month, right? So like I have to stay up to date on all of this. And a lot of that is done through most of that is done through my work at Veriheal, and also Marijuana Doctors. I guess I'm also a medical reviewer there now too, because they own that one. And I've been doing that work there too. So knowing your who your local resources are, and then in step with that as well, asking your patients where they prefer to source their cannabis medicine is going to be a good indicator of like, that's where I need to go and look at the menu, and familiarize myself with what their general offerings are. And then if you're really advanced, understanding, the differences between them, what times of day you want to be using them, how you want to use them, how much and how often. But basically, no, you don't have to memorize also the menu, because that menu can and does change, which presents a problem to both patients and providers alike. Because my patient, often I'll get a message being like, "Hey, Dr. Abe, my favorite one-to-one THC CBD just ran out at the Beyond Hello in Arlington. What do I do now?" And then I have to like know, what are their other options in the state? Is there another location? I'll pull up Beyond Hello and look at their other, try to use those tools to figure out where to get the next, closest formulation for them. And if it's not available, knowing how to teach the patient to mix their own. So, for example, I have a patient with a coconut allergy, and none of the dispensaries around them, they're all in MCT oil. And so they want to use a tincture, but how do they do that? And so I have to teach them how to make their own using, olive oil and like RSO, and how to blend those things together and how to get creative. But those are like obviously way to next level things. But the basics is knowing where the resources are to look for the up-to-date information.
Boy, I can't tell you how much joy you just brought me when you said for a doctor to go the extra step and ask a patient where they shop. Because this is not like you can say, hey, go buy some Tylenol at Walgreens. Because as you all know, who are shopping at dispensaries, dispensary A and dispensary B might have very different products. And even if you're just going to dispensary A all the time, just like you said, growers change their favorites, or they're like, we cycle through the strawberry cough, we're going to try something different. Well, there were a group of patients really depending on that formulation because it worked for them. And so that's something else we won't get into today, because it's a deep conversation about standardization of medicine. And that's another thing that understandably makes doctors nervous, because if they just say, hey, go take some weed for that, which hopefully the doctor won't say, but hey, you're going to need approximately this dose of this product. Well, it's hard for them to recommend because the products vary so much. But it just gives me great joy to hear you say that that you're considering that for your patients. And when we get to the point where more doctors are saying that, and I think you're one of the first doctors I've heard specifically call that out. Thank you so much. But when we get to that point, hey, we will have evolved greatly. I do want to turn to you all and see what questions you all have for Dr. Abe, because I've kind of dominated his time so far. So
All good.
what questions have y'all been sitting on or thinking about? And if you don't, I've got more.
I don't have a question, but I have a comment about what you were saying about reading the research papers that are done by scientists, and the difficulty in reading. Oh my gosh, I was
Right.
looking at that article and I was like, oh, so AI would be a great tool to use for
The
that.
pain is real, but yeah, AI, it rather than be frustrated, I encourage you to try it, right? And then when it gives you an answer that's unclear, challenge it and say, hey, well, what does this mean? And then then the nice thing about it, you can say, hey, cite examples of research about the same topic and give me links. And then do that breakdown for those too, or compare these 4 studies and it's going to make you so much more efficient as you dig into questions.
Yeah.
Dr. Abe put his link in his website, so I encourage you to check that out at your leisure when you get a chance. And there, thank you, Dr. Abe, as well, for the helpful guide for plain language. And we are always celebrating plain language. We do our best to write our stuff in plain language as well. Mike, what you got?
Just thinking about it, Doctor, everything you're saying as far as educating, the medical industry and the providers within it makes a lot of sense. Do those providers include pharmacists as well?
Great question.
Because I have a close relationship with some people that work in pharmacy. One is a pharmacist, and in those conversations, what it seems to me is that they have a very narrow range of sources that they use for their medical research. And if it doesn't come from these very few sources, then whether it's true or not, whether it's valid or not, whether it's recent or not, it just doesn't get to them. And I don't know if there's a pathway to work through that as well, just even from a perspective of interactions.
That's an amazing question. Thank you. And it does depend on which country you're in. I'm going to speak to the United States first, and then I'll speak to Costa Rica, because the difference is in their scope of practice, what it comes down to, what pharmacists actually do. In the United States, pharmacists tend to play a more limited role than here in Costa Rica. In the United States, a pharmacist will be great at compounding medications, making sure that the doctor's plan is more safe and sound for the patient, their kidneys, their liver, depending on their metabolic state, etc. So they're really very focused on micro level view, and then whether that is safe or not. Those studies are kind of limited in their point of view, and they also they're not urged to learn more about it because they're not the ones recommending this to patients. In the US, they don't have the actual authority to do that. They don't do that. But here in Costa Rica, it's different because they can. In Costa Rica, all of the cannabis products are only going to be available through pharmacy, whereas in the United States, it's all available through dispensary. And so here we have a totally different model, because here I can actually, like, even just yesterday, I went to my pharmacist and said, I've got, a toothache, what am I going to get? And they gave me an antibiotic and NSAID right away. But they can also sell CBD. They can also, and very soon they will have high THC products. And here in Costa Rica, the law is shaped that any pharmacist who's going to recommend cannabis has to take a training course. And so that's also where I'm also going to be designing the course with at least our Costa Rican pharmacists in mind. And in terms of the United States, it comes down to what the regulatory bodies dictate that the professional learn for their scope of practice. Because if they're not going to be, it has to be, unfortunately, like, compelling enough in their point of view to feel like, oh, well, this is something you're going to be doing in your practice, so yeah, you're going to have to learn it. For pharmacists, it's different because they're very focused on biochemistry and that kind of thing. They do care about your health, honestly, but they're not the ones going to be recommending it the way that the current healthcare system is set up, even though obviously I disagree. I think pharmacists should be more like they are here in Costa Rica, where they're just essentially a doctor with a shop that you can buy things from and you can consult on the fly. And that's fine here. And that's, also creates that helps a primary care prevention model, because in the United States, we're very focused on treating sick people and not teaching them about how to live a healthy life, eat well, live balanced lifestyle, include cannabis in it, and all these other things. And whereas in Costa Rica, we have very focused on preventative primary care. If you look it up online, Costa Rica is actually probably the best primary care model in the world, because we do things like, if a patient is too old, we visit them at their house. The doctor will come do house calls. The hospital sends doctors to do house calls for older patients all the time. If they're bedridden, if they're palliative, a doctor will come check on you every month, and it will happen. My parents get those services, and they're older. My dad's in a wheelchair. He's in a motorized wheelchair. He can't really go much anywhere, but the healthcare can come to him. In the United States, a lot of that burden is unfortunately put on the patient, and that creates heavy barriers, heavy costs for health and finances. And so increasing the role of pharmacists and their scope of practice to be able to recommend CBD hemp products will be the only way just about to get them more educated, unless they feel so, unless they feel so motivated on their own from living in an area like Colorado or Michigan, where they're more likely to be like, oh, so many patients have questions about this, I should probably just learn about this somewhere. So it's like a carrot and stick model, unfortunately, and it's going to come down to what the regulatory bodies say, and the way to change that is advocacy and education.
Well, I would agree
And
with that. And with talking with, the people that I know, there's also concern about licensing requirements and other employment requirements. So a lot of their usage is also clandestine. They have to hide it.
Yes,
yeah,
yes. And so the main solution would be having one federal decriminalized and legal policy where you have full medical and recreational access. That's what I believe in.
and here in the state of Washington, if you're a licensed medical provider, you risk your license by using cannabis in your recreational free time, or even use it medically in your free time, off the clock, in a way that doesn't impact your services. We work with a lawyer, one of our faculty members, who helps defend people's licenses who are challenged by the Department of Health. We hope that'll change, and we hope things will loosen up in that way, and even healthcare providers will have that freedom to use, because without that firsthand experience, they have to go off of what they read or what they hear. And we would like them to not just have the experience, but have the potential benefit as well. Um,
100%.
and mentioning pharmacy, if you are in the state of Washington, specifically SQUIM, and I know we have somebody on the call from SQUIM, Cedar Greens in Washington, just want to call them out because they're the only one I know in the state that has hired and on staff is a pharmacist, not acting as a pharmacist, but somebody who's a licensed pharmacist who is a consultant and bud tender. And so that person is able to share, cross those streams of knowledge and integrate that as they work as a cannabis consultant. That's pretty unusual, but hope to see more of that. We got time for about one more question. Anybody?
Yes.
Nancy?
Yes. I guess what I'd like to know is that beyond what I'm learning through this class, what could I do next maybe to help some of this research writing in layman's terms? I like to look at myself as quite a writer, and that would be something I could be interested in.
Awesome. And so the question is, how do you get more involved with writing about cannabis? Or help me
Yes.
understand
Yeah,
it.
any more courses I might take in that direction?
Oh, okay. It depends on how I guess joining professional societies like the Association of Cannabinoid Specialists or Society of Cannabis Clinicians, they do have really good courses. I don't know if they're available for the general public though. This is not something that I'm really aware of right now. If there
Yeah.
is, so I'm not sure I'm fully equipped to answer your question as best as I can, but I'm happy to get back to you on
Okay.
that.
Great.
I
Yeah,
think
it's
that
just something that's kind of new to me, actually, that I'm trying to see where this is going to go. And since writing is something I really enjoy and feel I'm good at, I think that would be a good avenue.
And there are a
I
lot of,
agree. Go ahead, Trey.
no, I'm sorry. There are a lot of non-medical publications, Nancy. Forbes, for one, that has taken time and has had a consistent pattern of having cannabis-focused articles that are written for the general public. And I think as you'll look out, the Fresh Toast is one that's not on everybody's radar. They do a lot of light stuff too, but they do a lot of short content that's very plain language. So that might reach out to me. In fact, I got a couple ideas of folks that are generally looking for writers, even if it's not a place you want to be
Okay.
long term. It might be a good place to start. So it's the challenge now for freelance writers is money, right? Getting paid real money for real work. So
Yeah.
I would just caution you about publications that might want to use you and not pay you. So make sure you get paid for your work.
Okay.
Thanks
Thank
so
you.
much for the great stepping in with a great answer, Trey.
No, well, we work with it. We've had this question before, and we've seen it go well, and we've seen people attempt to take advantage of people's interest, and that goes for the same in all industries, right? But we want to always caution our students, hey, don't be so passionate about this that you're willing to do something for free or for the promise of payment later. That's another thing that we encounter with a lot of startups. Somebody's like, hey, I'm gonna look out for you when we hit it big, when we go public, when we do this, then we'll look out for you. Watch yourself. You work for real money, and because there are a lot of promises out there.
Okay.
Dr. Abe, you have always lived up to your promise with us, and it's a joy to bring you back this time. And I hope that we're going to see a lot more of you. Talk to us a little bit about what's on the horizon for you, because I know you've got some exciting stuff. Anything you want to plug?
Yeah, just we're launching MEDEC CR here in Costa Rica. MEDEC stands for Médicos Educando sobre el Endocannabinoidoma y Cannabis. It's the English translation is doctors teaching about the endocannabinoidome and cannabis. The idea is to be an all-in-one shop for getting your courses, either basic or advanced, getting your certification that matches with that. And then, but not only that, we are also going to be doing, advocacy and, writing letters to the Ministry of Health in terms of like on behalf of our association in terms of the changes we would like to see made in either the regulations or the cannabis related policies. And then also what's different about us too is that we are also going to connect the patients and doctors with high quality, safe, legal cannabis products. So we'll do that through our partner, which is Vida Fortunata. And so Vida Fortunata is a fully integrated cannabis company here in Costa Rica. And they are now owners of Farmacia Azul, which means that they can import and export and distribute nationwide legally high THC and also cannabis and hemp products. And so basically the members of the association will have exclusive access to my partner Dan O'Brien's pharmacy and be able to recommend the best products. And so let's say a doctor in San Jose wants to recommend like a cannabis vape or something for somebody, they can put in an order through the catalog and they can have it delivered the next day without having to have it in stock, without the patient having to go to an intimidating dispensary, which is intimidating for newcomers. Everything being delivered through a pharmacy in Costa Rica, I believe is very normalizing, and it just feels so different that I go and get my CBD and I can get now, well, I'll be able to get that high THC through a pharmacy, through a doctor's recommendation that was like, yeah, buy this product and it'll be here tomorrow. And that's it. And then also what's different is that the doctor can also earn commissions from the sales. So in the United States, that's not allowed. You don't have commission structures or kickbacks from pharmaceuticals. But in Costa Rica, that's different. And the reason for that is to actually drive prices down in favor of the consumer. This is how in Costa Rica, you can buy 2 medicines, get a 3rd box for free, because a pharmacy will have a deal with that supplier. And so the best pharmacies will have the best deals for patients. That means lowering prices. And so the idea of having that is to create lower drive down prices for consumers. And so that's another important distinguishing feature about an association that's going to be different is that members will also be earning commissions on the cannabis medicines that they are recommending. And so this is a kind of a different model than you could do in the States, but we're really excited about it because it opens up a lot of opportunities for growing the doctor's practice as well as growing our association, which then fuels even higher quality cannabis education for the long term. And we do have some big partnerships incoming. I can't talk about them right now because they're not public yet, but just keep an eye out. And I'll just put in the website here if you guys want to check it out. It is medeccr.com, or just you can feel free to connect with me on LinkedIn, or all my socials are on my website. You can go everything drabe.io, and my portfolio is there too. So
Yeah, I encourage you all. I'm sorry.
No, go ahead.
I encourage you all, do check out drabe.io. Tremendous amount of information there. You talk about deep dives, he got you covered. Dr. Abe, we're really excited not just to have you as one of our smart friends, but excited for the work you're doing. That word normalization is huge. America, although we like to think of ourselves as exceptional in all categories, we're not leading the fight on cannabis changes, right? We're doing some good stuff, but it'll be efforts like Costa Rica that we're going to be able to turn to and say, hey, look, this is yet another example of how we can do it differently. We can do it better. We can do it in a way that's consistent from state to state. So the work you're doing is important to us too. Thank you so much. And thank you all for spending your Saturday afternoon with us at Saturday Sesh. We hope to see you back the first Saturday of next month when we'll have a lead researcher out of Washington State University who's going to talk a lot about the synergistic effect of cannabinoids. And so we hope to have you back then and more information coming to you that way. Thank you, Dr. Abe. Thank you, everybody, for spending your time with us, and we'll see you next time.
Thank you so much. It's been a real
Thank
pleasure
you,
and an honor.
Dr. Abe.